IWSP. What is IWSP? IWSP is Integrated Wellness Science and Practice. IWSP is a platform where we integrate modern science and time-tested traditional wisdom to transform your lifestyle to prevent, manage, and reverse disorders. We transform lifestyle to revitalize and rejuvenate. IWSP is your health partner, guide, and most trusted ally in your pursuit of health and wellness. We at IWSP are happy to share the wonderful response that we have had since the inception of the program, which has benefited hundreds of people worldwide. Under the IWSP brand, we have several programs such as IWSP Holistic Wellness, the Lifestyle Modification Program, IWSP for Life, Self-Help Remedies for Musculoskeletal Issues, Addressing Hormonal Issues in Women, Seri Made Talks on Integrated Approach to Health, and many more. You can visit us at www.myiwsp.com to know more. Integrated Wellness Science and Practice is brought to you by a team of passionate professionals working in their voluntary capacity from different parts of the globe. We begin by introducing our esteemed facilitator, Dr. Susheel Sharma. Dr. Susheel Sharma is one of the leading cardiologists in the world today. Dr. Susheel has more than 4 decades of practice behind him, at the top of his profession as a board-certified consultant cardiologist based out of Maryland, USA. Dr. Susheel has been associated with prestigious professional research and educational organizations. He has over time been able to conceive this idea of integrated wellness and has proven that it is possible to reverse major lifestyle issues. His amazing ability to make things lucid and simple, enabled through mastery of evidence-based research, is the most critical element, which makes this course a must for all of us. We take immense pleasure in introducing our esteemed facilitator, Swami Dayadhipananda. Swamiji is a doctor by profession, and he is the force behind making this IWSP Holistic Wellness Program a reality apart from being an efficient hospital administrator. He specializes in the practice to address complex health issues through lifestyle modifications. After completing his medical degree, Swamiji chose to dedicate his life to serving humanity by becoming a monk in the Sri Ramakrishna order. He serves as medical superintendent of the 120-year-old, 200-bedded charitable mission hospital in India. Swamiji is an expert administrator, with his hospital serving the poorest of the poor in these difficult corona times with utmost passion and devotion. Swamiji special in treating type 1 diabetic children and hundreds who benefited from his expertise. He is a pillar in spirit behind this IWSP Holistic Wellness Program. Our colleague Mr. Bhupendra lucidly demonstrates the practices of integrated wellness for all of us to effectively learn and imbibe in our lives. Our team consists of senior accomplished volunteers who support the comprehensive back-end operations to enable our facilitators to successfully conduct the program. Dr. Subrata, former Associate Director at CDUC, Bangalore. Mr. Anirban has 3 decades of experience in leading multinational corporates in the automotive industry. Mr. Naresh has 2 decades of experience in leading multinational corporates in the automotive industry. And Karthik is from Reach Healthcare Services. Now, we will listen to Dr. Susheel Sharma on his views on the what and why of IWSP.
Hello and welcome to IWSP. I'm grateful and thankful that you joined. It's been a year since we started these programs. Over 500 people have benefited, and we're going to have a wonderful time together for 1 month for going through life transformation and benefiting and getting good health. So first of all, let me just give you a background who I am and what IWSP is and who we are. It's been 45 years since I've been a graduate of medicine. I did my undergrad and postgrad in India and worked there for 5 years. Then I moved to England, where I did further higher education in medicine and then started doing my cardiology fellowship. And I did specialization in cardiology in England. And then I moved to America at Henry Ford Heart and Vascular Institute in Detroit to do my super specialization in interventional cardiology. And then I started practicing in Washington, D.C. area. And I did over 10,000 of these procedures called heart catheterizations and inserted stents, did atherectomies, and all kind of procedures. So all kind of blockages that could go inside the arteries, I saw them. And I saw them year after year. And I also noticed that there are a certain set of people that keep having these blockages on a recurrent basis. And that somehow motivated me to look more deeply into it. And what I found out was that there are certain set of habits, characteristics, dietary pattern, and lifestyle pattern that contribute to these blockages coming again and again. And that is what sparked my interest in prevention, and started looking into IWSP type program that I did before and started evolving on that journey. At the same time, something very tragic happened. My best friend, who's also a cardiologist in India, he was 60 years old at that time, and he dropped dead in the middle of seeing patients, most likely a heart attack. And that also sent alarm bells. And then I put everything together and found out that my father had a heart attack, my mother had a heart attack, my brother had a heart attack. So I have a very strong genetic predisposition to have heart disease. So I have to do something for it. So then I looked at all the things that are going on in prevention. And what I found out was a deep divide. And the divide was people that believed in Eastern methods of yoga, meditation, and some herbs and some concoctions and things. They believed that that is the only way to treat heart disease. And people in the West who are into medicines and procedures and technologies and bypass surgery, they felt that that is the only way to treat the heart disease. From my experience, I found out that there are good things in both. There's good things in science that obviously comes from the Western medicine. And there are very good things in our Eastern ancient practices from Vedanta, yoga, of pranayama, meditation, and yoga. So I thought, why not get both, combine them into a program and provide a comprehensive prevention program that has the best of both the worlds. And that is where the journey began. And then I teamed up with our Swamijis. Our Swamiji also, by the way, is a doctor by profession prior to becoming a monk. And he has a unique set of qualities. And the unique qualities are that he is a student of science because he's a doctor, and he's a student of Vedanta. So he brings in the ancient wisdom, the best of yoga, meditation, pranayama, being in Haridwar and training it all together. So he combined all these things together. And he also was very much interested in the same thing. So I ended up being in Haridwar. We spent a month together. We did this program together on ourselves first. And then we saw our own numbers change. Our cholesterol come down 20%, our health got better. And then we thought, why not make it a general program? And that is where Subratoji, Nareshji, and Anirbanji got together with us, and IWSP was born. And then we had 5 batches, 500 people, and very many happy people. And now we want to share the same science, same program, and same practices with you. Okay, so this is the year of COVID. I know you've heard a lot about COVID, but I am talking about COVID from a different perspective. If you really look at, this is just the data from New York, but this is echoed all over the world. If you look at the people that had the highest mortality, they had few things in common: blood pressure, diabetes, high cholesterol, coronary artery disease, old age. So if you put the top 4 of these together, hypertension, diabetes, hyperlipidemia, along with obesity or overweight, it's a constellation of symptoms which is called metabolic syndrome. And this is a strong predictor of mortality from COVID, because this is the group that has lowered immunity. So basically, if you have COVID and you have metabolic syndrome, you have a higher mortality. And metabolic syndrome also is the one that contributes to other illnesses like heart attack, stroke, blockages, So all that blood pressure, diabetes, cholesterol, overweight, this is all a component of this metabolic syndrome. And the good news is that this metabolic syndrome can be managed and treated with a lifestyle change that you're here to discuss and learn today. So some of you may know these beautiful people accomplished in their own field and done great work in the field of entertainment and medicine. And if they knew that there are simple tests available that you can do today to detect whether you do or you do not have a predisposition to have a heart attack and sudden death. And if they knew there are simple ways to change your lifestyle to prevent heart attack, these beautiful people would be with us all today. But anyway, from their tragedy, we learn a lesson. And the lesson is that we need to take care of our health. We need to do simple tests and learn them in this program that we can do to see if we have beginning of the problems that they had and we do not end up being the same way. Okay, this is one figure I want you to remember, 80%. Now that's a pretty high percentage, right? So if you really look at these 9 illnesses that I'm highlighting here, high blood pressure, high cholesterol, diabetes, overweight, heart attack, stroke, dementia, kidney disease, and some cancers. Now, some of you may have it and some of you may not have it. And those that do not have it, I can tell you, you have an 80% chance over lifetime to develop these. So what else is 80% about it? No matter how we die, we may die from a stroke, a heart attack, or a cancer, or kidney failure, or anything else. There's an 80% chance the cause of our death will be the consequence of these 9 conditions that I mentioned there. These are called lifestyle illnesses. What else is true? If you really look at all the money that you're going to spend over your lifetime on your health, 80% of your health budget will be spent on managing either blood pressure, diabetes, cholesterol, heart attack, stroke, dementia, kidney disease, cancer. You get kidney failure, you have a recurring cost of dialysis. You get a heart attack, you have exorbitant one-time cost of bypass surgery. If you have stroke, you have tremendous recurring cost of getting physiotherapy and care. And at the end, there's a good news. And the good news is that if you practice the lifestyle change that we are going to talk to you over the next 1 month in a set of 12 lectures, 45 minutes a day, giving you all the scientific data, you have an 80% chance of either managing, improving, or curing these illnesses. So if you practice integrated wellness science and practice, if you follow our DASH program that we have, then you should be able to eliminate these illnesses through change in your lifestyle. Now, you all know there's some risk factors for heart disease. In my case, is my family history, right? And as my age advances, I have a chance of getting heart attack. And also gender, I'm male. Male have a higher chance of getting heart attack. So my age, my gender, my family history is stacked against me, but none of this I can change. This is the card that I've been dealt with. But I have blood pressure, diabetes, high cholesterol that I can control. So I do not have blood pressure, do not have diabetes, do not have cholesterol, because I knew that my age and my gender and my family history stacked against me. I had to change my lifestyle and not to get blood pressure, not to get diabetes, not to get high cholesterol. How did I do it? I did it with lifestyle. I decided not to become overweight. I tried to stay active and do regular activity, exercise and yoga, eat very healthy diet, which I'll discuss with you. I don't smoke. And I try to manage stress as best as I can. But you all know stress is part of life and we all get stressed out from time to time, but I try to do my best. And this is what you also have to do with us when you do this program. So what is lifestyle briefly? It is the way you eat, the way you move, the way you have certain habits and addictions, the way you control your stress, the way you sleep, and the way you maintain relationships around you. All these, your psychosocial setup, they all have an impact on your lifestyle. And this is what really finally ends up leading to that metabolic syndrome if you do not do it the right way. So is it tough? No. Look at Bill Clinton, American president. He had bypass surgery, then his bypass closed, then he had stent, and then again stent, and then again stent. And he finally realized that is not the answer. The answer is to change his lifestyle. And I'll talk about who he talked to for his lifestyle change. You'll see in subsequent third or fourth slide. He called in Dr. Esselstyn to his office, who modified his diet, changed his lifestyle, and you see the change that he had. And on the right panel is one of our own. He attended the IWSP, and he was kind enough to give us his pre and post pictures, transformed. And this happened in 6 weeks. So when you do 4 weeks of IWSP program with us, you will change. Your lifestyle will change, and you will feel the benefit. And then this program that you do for 1 month then buys you a ticket to do IWSP Live with us for the whole year at no extra cost. And that is where you really see the transformation. And the transformation is as profound as the transformation of a little larva that becomes a pupa and then becomes a beautiful butterfly that flies off. This is a drastic change that you'll see in your lifestyle. And this is what is going to prevent metabolic syndrome. This is what's going to reverse your diabetes, reverse your cholesterol, obesity, high blood pressure, prevent your heart attack, prevent your stroke, treat your kidneys, improve your lungs, prevent dementia, and prevent some cancers. Okay, so let's take a few examples. Now, obviously, I can't talk about all 9 because time doesn't permit, but I'm going to talk about some of them that are common and you may have in mind. So this was a pioneer trial, and this is, by the way, Dr. Esselstyn in the right inset. He is the doctor that Bill Clinton invited to change his lifestyle. And the left panel, you're seeing some angiograms, and the white image actually is the artery. And even without you being cardiologist, you can note that some arteries in the left panel are pinched, and the subsequent panel are opened up. Now, these arteries opened up not with a medicine, not with a stent, not with bypass. Dr. Esselstyn published this paper, pioneer paper, where he opened these arteries with diet alone. This was only treatment. Dietary treatment was the only treatment offered by Dr. Esselstyn. And he had patients that came to him with blocked arteries who are going to have stents put in, going to have bypass surgeries, that had heart attacks before, and they unblocked their arteries by changing the diet alone. So what was that diet? Well, we're going to talk about it. Now, this is, let's say, the left panel is somebody who's overweight, and he wants to look like the one who's on the right side. Now, first of all, let me clarify here. I do not like the word obesity. We are not doing this program for some kind of vanity or for some kind of size and shape that you need to look at. We are really doing it for lifestyle change. You could look exactly like the guy in the left panel, but you change your lifestyle and get all the health benefits without actually changing your shape. We are not here for body shaming. We are not here for vanity. We are here for transforming your life. So also, whoever you are, wherever you are, whatever you look, you're beautiful for IWSP. And you should like and you should love yourself. And this is also part of one of the practices that you'll see in stress management that we emphasize. You have to like yourself and you have to love yourself. If you don't like and love yourself, how can you like and love somebody else? And therefore, you have to practice self-compassion, and we'll have a detailed session on self-compassion, how to practice self-compassion, improve your self-image, like yourself, and love others. Anyway, so this person says, I have too much fat in my body. I have an obesity. I need a solution. I need to look like the guy in the right-hand panel. Okay, so this guy eventually looked like the guy on the right-hand side. All the fat was gone. So what did he do? Well, he had some hormone injections to burn his fat. He took some pill to kill his appetite, stopped eating, and lost weight and became thin. It didn't work completely. He had gastric bypass surgery. He made his stomach shrink. And whatever extra fat was left there, he went to a dermatologist and had liposuction done. So if you look at all this, there are modern scientific methods available to make you look like whatever you want to look like. But you have injected some pills in your body, you injected some hormones in your body, you have done some surgeries on your body, and you've done some cosmetics and liposuctions on your body. And that is what makes you look like the guy on the right-hand side. Now, all of you might think that it's a good thing. Is it good? I don't think so. Let me tell you why it's not good. Your outside may look as thin as it is, but there are problems on the inside. Now this person feels nauseated and dizzy because his stomach clipped, he has low blood sugar because there's dumping, he has malnutrition, he has some vomiting. After eating a little bit of meal, he becomes bloated, he has distension, post-surgical strictures come in, post-surgical ulcers come in, gallstones come in, hernia can happen, bowel can have problems. All these things can happen to this guy. Unfortunately, he has not reduced his risk of heart disease, stroke, and cancer. That did not change because all that changed was the way he looked on the outside, but the inside was unhealthy. And therefore, he did not get any benefit of change. So problem, he's obese. And that obesity predisposes him to metabolic syndrome, which can cause high blood pressure, diabetes, cholesterol, heart attack, and stroke, right? And that is because there is too much fat in the body that has gone in because of certain reasons. Well, what do we suggest? We say treat the cause of the cause. The fat is the cause of metabolic syndrome. Well, how did the fat get there? That cause has to be treated. And that is what we addressed in IWSP, how to remove the cause of excess deposition of fat in the body. And how do we do that? We do that with lifestyle change. And that's all this program is about. It is going to change your lifestyle. What is a lifestyle? A lifestyle is which is stress-free. Stress is a silent killer, and we all have stress. And do you know that 80% of the time you visit a doctor, that illness has some component of stress in it? If it's your blood pressure, there's a component of stress. If there's cholesterol, there's a component of stress. If there is sugar, there's a component of stress. It accounts for the third highest healthcare expenditure. And unfortunately, only 3% of physicians really address stress. We address stress in a very deep way. We tell you exactly where the stress comes from. How do you deal with the stress? What are scientifically proven methods of de-stressing and preventing the effect of stress on your body? Because stress leads to cortisol secretion. Cortisol secretion leads to obesity and truncal obesity and metabolic syndrome. So let's look at another area. Let's say you have headache. You go to your doctor, he checks your blood pressure and he says, oh, you have high blood pressure and it is causing your headache, but you want your headache to go away. He says, okay, let me check your blood pressure. Your blood pressure is 145/90. Well, you need to take a capsule, and he gives you a capsule for blood pressure. Now, let's say after a few days, your blood pressure has not come down, and that actually was the lowest blood pressure. And the next time the blood pressure is even higher, 160/100. What does he do? He says, okay, well, if it's 145/90, you need one pill. If it's 160/100, you need two. Now there's a second blood pressure pill added. Then you go back to him. Now your blood pressure is even higher. It's 175/110. Why is this happening? Because there is something that there's a cause of blood pressure that you're not treating. You're basically treating a number, suppressing a number with a medication, and it ain't going to work. Now he adds a third pill. So each pill of blood pressure lowers blood pressure by about 10 to 15 millimeters of mercury. So if you're at 175/110, you're now going to need 3 different medications, and you have to deal with their side effects, and you have to deal with their cost. This is a lifestyle study published and recommended by American College of Cardiology. If you look at things mentioned on this, it's a busy slide. Don't worry about it. We'll put it on WhatsApp for you. But each of these components can reduce the blood pressure by 5 to 10 millimeters of mercury. Now remember, collectively, if you did all of them, you improved your blood pressure by 40 millimeters of mercury. Remember, I told you one medication lowers blood pressure by 10 to 15 millimeters of mercury. So if you did this lifestyle change, you effectively eliminated 3 blood pressure medicines if you're taking. So if you're on 1, it's gone. If you're on 2, it's gone. If you're on 3, it's gone, just by the lifestyle change. And every piece of information published on this slide is backed by scientific data. So your wellness key, we say, in the integrated wellness science and practice is our DASH program. So what is DASH? What we believe is that if you make positive changes in your diet, your activity and sleep, stress management, and habit change, in these 4 areas, if you make significant changes, that is what really you need to change your lifestyle to get all the benefits that we talked about. Now, diet, right? We'll talk about diet. Some of you may say, oh, well, doctor, I don't need to attend this program. I eat vegetarian diet. This is a study recently published in 2017, where they looked at people from Nurses' Health Study and physician studies, that people that ate vegetarian diet, but unhealthy vegetarian diet. So a vegetarian diet can be healthy plants and can also have unhealthy plants. If you're eating unhealthy plants, unfortunately, your health was worse than people that were eating animal food and meat. So just because you're vegetarian does not mean you're eating healthy. You have to eat healthy plants, healthy vegetarian diet to be healthy. And we're going to talk about that. So why should your diet change? This is Dr. Dean Ornish. And his was the very first study published in New England in Lancet. Can lifestyle change reverse heart disease? And it demonstrated by changing the lifestyle, you can actually prevent blockages developing in your arteries. This was the landmark study. And based on that, we think the first component that we have in our DASH is on the diet. And in the diet, we're not just going to tell you eat this and eat that and this carbohydrate, this protein and this fat. No, that is not what we talk about. What we talk about is the diet that makes a difference, which includes not just instructions on what to eat and what not to eat, but also how to eat. We will take you through the anatomy and physiology of digestion, why certain foods are not good for you. Why are you having bloating, insomnia, indigestion, heartburn, sour eructations, inability to sleep, all these things that you're getting. Why are you getting them? Because you're eating wrong food the wrong way. Okay, so if I ever told you that there was a wonder drug available for wellness, it's affordable, it has no side effects, it can reduce, as published in the studies, your heart attack risk by 40%. It can reduce your diabetes risk by 50%. It can reduce your stroke risk by 27%. And it can reduce your cancer risk by 50%. And if I tell you it has no side effects and it's free, almost, would you now want to take it? Yes. And that X is physical activity. Physical activity is the closest thing we have to a wonder drug. Now, in this program, we're going to give you lots and lots of scientific studies, and this is one of them. Across the board, they looked at people that did very little exercise, some exercise, and significant exercise. And whether they had high blood pressure, diabetes, smokers, obesity, high cholesterol, COPD, everybody that did some kind of exercise more than what he was doing before had better result. All the people across the board that are active have lower incidence of blood pressure, lower diabetes, lower heart attack, lower stroke, and lower cancers. And in the activity, you're going to learn the science of activity, and you're also going to see the benefits of yoga. Now, we recommend yoga as the preferred method for physical activity, and I'm not going to talk about it because Swamiji has a detailed presentation to follow on it. but we're going to tell you exactly what kind of activity you should do, how long you should do it, how often you should do it. Along with activity, we will also tell you what is the science behind rest and rejuvenation and sleep, why sleep is important, how many hours of sleep do you need, and what is sleep hygiene. Just like there's a hygiene that you do with wash your hands and social isolation and all those things for COVID, there's a sleep hygiene. If you don't follow those hygienic sleep principles, your sleep is going to be disturbed. So if you're not sleeping well at night, wait and see the program, and you will find out very simple ways of how to improve your sleep. For stress management, we have picked up these 9 practices that we'll discuss in detail. We will discuss the scientific study behind each one of them, and we will prove to you how each one of them stand alone is capable of long-term stress management, and how you could pick 1 or 2 or 3 and deal with stress on a daily basis. Making stress go away or hoping and wishing stress go away is not living. As long as you live and I live, there'll be stress. We need to strengthen our mind and our coping mechanisms of how we can deal with stress. And we give you scientifically proven techniques for stress management. Now, habits. Now, eating again is a habit. Drinking is a habit. Smoking is a habit. Most of the things, not exercising is a habit. So this is one of the studies that we'll talk about. And this gentleman was a New York Times reporter who did some research on his own on habit and came up with this beautiful book by Charles Duhigg, The Power of Habit. And we'll talk about his habit loop theory also, how scientifically actually by tweaking the loop, you can change habits. We will discuss the science of habit. We'll tell you how neuroplasticity forms, how when you do certain things in a certain way in your brain, a channel forms, it gets strengthened and it becomes a highway. And no matter what you do, the information always travels on that channel. And how do you then change that channel? And that is the habit change. And what is the science behind it? What works, what does not work? You can only change the habit with a scientific way. There is no pressure, shaming, blaming, beating up, insulting does not change habits. Okay, so why should you then do IWSP? Because, as I told you in the beginning, everything that we will present to you in this integrated wellness science and practice program will have scientific data behind it. We are integrating the modern science with our ancient yoga Vedanta knowledge. And you will learn meditation, you will learn pranayama, and you will learn yoga live with Swamiji. And it's experiential. You will do it live together. And what changes we are bringing up in our lifestyle, we are sharing with each other on a daily basis on WhatsApp. What we eat, we're going to share. How much we moved, you're going to share. So this connecting and sharing and caring and learning together is really a unique component of IWSP. And that's exactly the reason why we think that you should come and listen to us. You should know the scientific facts. You should practice those scientific facts. You will then have your own experience, and then you have your experience as your best guide and motivator for you to change your lifestyle. So this program will be spent over 12 sessions. Today was the introductory session, and then there'll be a session to follow where I will discuss really what is the pathologic internal mechanisms that cause these problems. And you'll hear some beautiful new theories, new things that you may not have heard before. Chronic inflammation, which is so topical these days, how inflammation predisposes to infection. And in fact, all these metabolic syndrome patients in COVID that had high mortality also had pre-existing inflammation in their body. And there's a food that predisposes you to inflammation. There's a lifestyle that predisposes you to inflammation. So there is a pro-inflammatory way to live, and there's an anti-inflammatory way to live. You will find out what damages the inside of the lining of your blood vessels, the endothelial injuries, what is circadian imbalance, why you need to have a balanced life, and what is autonomic imbalance, and how that gets corrected by pranayama and yoga. You'll learn the science of that. We'll devote 3 full sessions to diet. I'm going to talk about the anatomy of digestion, healthy and unhealthy food, how to eat, what to eat, when to eat. Every question about diet will be answered. We'll have 2 sessions on activity, 2 on stress, 1 on habits, and then in the end, I'm going to add 4 more pillars. Why you should need sunshine, how do you improve your sleep, how do you get circadian alignment, how do you know your numbers? Remember, I told you right in the beginning, if those people knew by doing certain tests where the numbers stand and what they had, they could have taken preventive measures and unfortunately not had to succumb to what they succumbed to. And we don't want that to happen to you. And therefore, we want to share that with you, that all that information. And in the end, we're going to go ahead and sum it all up for you. So remember, you owe it to yourself. What you plant today, you will harvest tomorrow. The kind of lifestyle that you have today is going to determine whether you do or do not progress to have those illnesses that we talk about. So the onus is upon you to plant the seeds of a healthy lifestyle today. And also remember, goal without a plan is just a wish. You really need to know what works and what doesn't work, and then have a plan to do that. Do not practice unscientific methods, because if the method is unscientific, the outcome will be unscientific. It's not going to help you. So see what works, see what's published, see what's good for you, and come and join us. And please commit yourself to this program. And the more we do it with you, the more we learn, and the more I research about it and share with you and benefit from you. So really, when you join this program, in a very large way, really, you're helping me also. And I'm very grateful to you for that. And on behalf of the team, I invite you all to come join us, and let's begin the session and do all this journey all over again together. And this will be a great time together for all of us. Thank you very much. Namaskar. Thank you.
Namaste everyone. Very glad to have you all in this introductory session to the IWSP Yoga. My esteemed participants, this unique program, Integrated Wellness Science and Practice, or the Holistic Wellness Program, is very unique. We are going to learn all the scientific, evidence-based methods to make our lives better. When it comes to yoga, it's a huge topic, but here we are going to restrict our learning and sharing only to benefit us physically and mentally, so that we become disease free. At the same time, we will learn the methods to stabilize our emotions, and also we will learn some yogic methods to keep us free from stress. Above all, we will be learning some unique technique to get the joy within the meditation techniques. So, why yoga? Because yoga impacts all the 4 pillars of our dash. Dash is the basic foundation on which our program is going to run. So, diet, activity, stress management, habit change, which is the unique thing to make our life a better life, to make ourselves disease free. This yoga has all the aspects it's going to cover. That's why we have to practice yoga, not just some other physical exercises. What we are going to learn? Asanas. Asanas are typical postures in which we practice and train our physical body. These postures, which have got proven health benefits, which have got proven techniques to make you free from certain physical diseases. So, these asanas are very vital to attain wellness. We are also going to learn about pranayama. Pranayama is nothing but the technique to control our breathing, the technique to regulate our breathing. When we learn how to regulate our breathing, we are free from majority of the mental health issues. The stress aspect can be removed. The stress can be removed or cured by learning properly the pranayamas. Meditation is the ultimate medicine. The ultimate medicine for all sorts of physical, mental, emotional disorders. Meditation is the highest technique to find the joy within. Meditation should give us the ultimate rest which we all need after working in certain hours. So, we will be mainly learning asana, pranayama and meditation. Dear friends, let me tell you, based on the research papers, meditation, though known little and practiced by very few people, but the health benefit when it's learned, 75% of the health benefits are by proper meditation practice. And pranayama, also less known and practiced by less people, has more benefits than the simple asanas, the physical postures. You can see, based on the research papers, we have learnt 15% health benefits from pranayama, and the physical asanas has got just the 10% health benefits. Yes, each has health benefits, but asana, pranayama, meditation, when compared, meditation has the highest health benefits and it is proven. Dear friends, why yoga, not just some gym or other exercise? It is studied and proven by researchers. Yoga is more effective. Yoga is more beneficial, as it helps to maintain the health of every cell of the body, every part of the body. Whereas gym, whichever part you are using, only that part muscle is going to get the strength. Only that part of the muscle is going to increase in size. After doing the yoga, you feel energized, you feel fresh, you are not losing your energy. But after doing gym, people say, I am tired, I want to take rest. That way it's going to affect your daily working pattern. And by practicing yoga, one feel fresh, happy, joy, all the good hormones, the positive hormones, the happy hormones are released in our body when you practice yoga. One feels tired after practicing gym because the stress hormones are going to be released in your body. Yoga can be practiced by everyone, right from kids to aged people, but the gym and other athletic exercises cannot be practiced after certain age. Yoga affects all the internal organs. It rejuvenates all the internal organs. We call it as visceral organs. Visceral organs are going to be rejuvenated. You are going to regain health. All the internal organs are going to attain a state of health. But there are no proven studies which said by practicing gym one attains health of the internal organs. And important factor in today's day-to-day life, stress. Stress has become a major factor which affects the mental and physical health of everybody. By practicing yoga, one is freed from stress. To lead a stress-free life, one should practice yoga, whereas there are no proven health benefits of gym which says it has got some psychological benefits. So why yoga should be practiced and preferred when compared to other exercises like gym, etc. When we understand more about yoga, when we learn step by step and we reach, we learn that we are not just this physical and mental combination. We are not just body and mind complex, but there is something more, energy, Atman, Brahman, God, Ishvara, Allah, Buddha. That energy is the cause for everything in this universe. That same energy runs our body and mind. Because of that same energy only, we are all connected to each other. So, we will be learning more about yoga in our whole course when we join and learn. Mainly, we will be teaching you 15 basic asanas. 15 basic asanas which have got proven health benefits. Learned and practiced properly, these 15 asanas have got immense role in making you free from certain physical diseases or disorders. So, we will be learning yogic jogging, sukshma vyayama, surya namaskara, shavasana, mandukasana, shalabhasana, ustrasana, gomukasana, vakrasana, utthana padasana, sarvangasana, halasana, shalabhasana, dhanurasana and rukshasana. And every asana will be taught by our expert yoga teacher who is a certified yoga teacher, and we will also be learning about the immense health benefit of every asana based on the scientific papers. So, these few asanas I am going to show you. For example, you are seeing the first one is Vakrasana, Sarvangasana, Tadasana, Mandukasana, Ustrasana, Dvibutthana Padasana, Gomukasana, Surya Namaskara and Dhanurasana. So, by Yogasana, we need not worry, oh, it is so difficult to learn. No, it is very simple. Anybody, everybody who is interested to get the benefit can learn, practice and enjoy the benefits. Also, we will be teaching you main 10 pranayamas. I said by the word pranayama, we learn the technique how to breathe properly, regulation of the breathing, the prana shakti, the vital energy when it is circulated properly in our mind and body. It helps to increase the blood supply, it helps to increase the oxygen supply, proper oxygen and blood supply to every cell of the body. We have immense health benefits. So, mainly we will be learning about Brahmri, Anulom Vilom, Bhastrika, Kapalbhati, Udgit, Sarala Pranayama, Antah Pranayama, Bahya Pranayama, Ujjayi Pranayama and Omkara or Pranava. Also, we will be learning the immense scientifically proven health benefits of this pranayama. So, to show the pictures, here we see the left one sitting and chanting Om, the right one Anulom Vilom, alternative nasal breathing, the left bottom is Brahmri and right bottom is the Kapalbhati. So, pranayama has immense health benefits, more benefits than the physical asanas. Meditation is the ultimate technique. Meditation is the ultimate medicine to cure all sort of diseases, physical, mental, emotional, by attaining the spiritual nature, our real nature. When you attain that state, there is only happiness, a disease-free life. So, we are going to learn the proper meditation technique learned by our great teachers, our gurus. With that Guru Parampara, whatever we have learned, we will be learning and practicing together, and I am going to guide you this meditation session. Dear friends, with this brief introduction about yoga in this holistic wellness course, we all as a team are committed for the physical, mental, emotional health of all of you. We request you to make a commitment, invest your time so that you lead a disease-free life. You make a better choice, and also at the same time you are going to lead a better life. You are going to enjoy immense health benefits by registering and learning about IWSP, the holistic wellness course. Thank you. Namaste.